Good evening and thank you for joining us. Canada's Chief Public Health Officer has a stark warning. We're running out of time to prevent a major resurgence of COVID-19. New numbers out of Quebec show just how dire the situation is right now. For the third day in a row, the province is reporting more than 1,000 new cases. In Ontario, the province's daily count is 566. Despite the spike in cases, Toronto Public Health is changing the rules around contact tracing. If you get infected in Canada's largest city, you may have to break the news to your friends and family. Abigail Bimman explains.
In Toronto, cases are climbing so quickly, Public Health is now asking those who test positive for COVID-19 to do their own contact tracing, giving instructions about how to notify close contacts.
Given what direction our numbers are going, well, that doesn't bode well, does it?
There's no change to the handling of high-risk situations like outbreaks in long-term care and schools.
I, in fact, think this is going to erode public trust and confidence. There'll be an extremely high level of variation with that. Some people will be highly responsible. Some people, I'm guessing, won't do it at all.
Toronto is canceling or putting contact tracing on hold, and Ontario is telling us, close the testing centers, let's catch up on the backlog. That's illusory. That does not give us the information that we need to be able to protect our communities.
Our health system is in crisis.
In the nation's capital, where the case count is also high and testing lines long, Public Health confirms contact tracing continues. But neither Public Health nor the province nor the hospital that runs this test site would explain why it stayed open Sunday after Ontario's premier said all sites would be closed to walk-ins for 2 days as they transition to appointments booked online.
Those images, which we've seen across Ontario, really put public pressure on, but if it's only online booking, it's invisible. There's no way to know how many people tried to log on and couldn't, how many people tried to access a test and couldn't, and we don't know what happens to them after that.
In Quebec, case numbers topped 1,000 for the third day in a row. The country's chief medical officer of health put out a statement Sunday focused on Thanksgiving. Dr. Theresa Tam says we've got some serious planning to do, though she didn't go as far as urging cancellations as the Prime Minister hinted at last month.
It's all too likely we won't be gathering for Thanksgiving.
Tam recommends layering up on clothes, heading outdoors, and keeping a picnic table length apart from those not in your bubble, and not to share food with them. Indoor dinners will be safest if small and select, especially in the country's hotspots. Abigail Bimman, Global News, Ottawa.